Hi everyone, my name is Dr. Tiffany Mullen. I'm the CEO and co-founder of Vital Health, and I'm also an integrative and functional medicine physician here. And today I want to talk a little bit about personalized mental health, solving for root cause. So by personalizing our approach to mental health, we can have better outcomes, potentially use less medications, or if we're using medications, getting the medications right at the beginning, but oftentimes solving for underlying depression, anxiety, etc. Something that is really not well known in the traditional medical community, that mental health approaches can be customized and should be personalized, in my humble opinion. So let's get started. Here's what you're going to learn today. So we're going to talk about neurotransmitters, what they are, what types are out there, and what exactly they do for us and how they influence our mental health. We're going to talk a little bit about genetics and how our genes impact our neurotransmitters and mental health. That's something that's kind of interesting. We know that there's when we talk to patients, there's lots of people who have family histories of depression and anxiety, but a lot of times we can actually get at some of the underlying genetic reasons and solve for that. So you'll see when I talk a little bit about that later. We're also going to look at natural ways to treat depression and anxiety. So if you're someone who has not tolerated medications well or would prefer to go a natural route, there are some options for you as well. So let's talk about what a neurotransmitter is. It's actually a messenger from one nerve cell to another. So you can see here's two nerves coming together. And in that space between the nerves, those little pink bubbles are the neurotransmitters. They're released by one nerve and then they're taken up by the other nerve on the other side. And as you might imagine, since the brain is basically just a bundle of nerves, there's a lot of neurotransmitters up there. And we think that some of the reason that we have behavioral health issues, not all, but some of the reason is that we have neurotransmitter imbalances. Something is too high, something is too low, and our pharmaceuticals that we have available to treat depression, anxiety, and other mental health issues target neurotransmitters in the way that they work. Things like Prozac keep serotonin in between those cells longer, for example. So there are different types of neurotransmitters, and this is a short list, but I just want to draw your attention to the difference because one can have an imbalance here that would cause either the person to feel nervous and anxious, or conversely, they could feel depressed and down. We have inhibitory neurotransmitters, which feel calming to the person, things like serotonin, 5-HIAA, which is a precursor to serotonin, GABA, and glycine all have a calming effect on the body and on the mind. Excitatory or stimulating neurotransmitters have the exact opposite effect, as you might imagine. They actually pick up our mood, make us feel motivated, get us going. Things like glutamate, dopamine, histamine, and epinephrine are excitatory neurotransmitters. So let's talk about a pretend patient that has had gone through basically the difficulties of trying to figure out how to manage her lifelong anxiety and panic. She'd had this since a teenager. She couldn't remember a time when she didn't have anxiety. And she was treated over the years with lots of different medication approaches by her physicians, none of which really worked. Not only did they not work, but she really had side effects to all of them. So she was very frustrated. She wasn't able to get relief from her anxiety. And it really impacted her work and her relationships. She struggled a lot with her marriage. She had problems at work, becoming very anxious. She had a hard time sleeping, and she was very sensitive to caffeine. The smallest amounts of caffeine would both cause her anxiety to increase as well as disrupt her sleep. So we started off by looking at Stephanie's cortisol. Cortisol is the chronic stress hormone that's released by the adrenal glands, those glands that sit on top of the kidneys. And in Stephanie's case, you can see the normal curve of cortisol is to rise at around 3 o'clock in the morning, to peak at about 7 in the morning. That's the tallest part of the mountain. And then cascade down to a low point around noon and then continue to slowly decrease throughout the rest of the day. And if we followed her out, it would be another swoop, basically another roller coaster swoop, just like this. We call this the diurnal cortisol rhythm. Every day we have a cortisol rhythm that goes up and down. Now, Stephanie did a cortisol test where she did a saliva sample 4 times during the day, and you can see her sample are the black dots on this curve, and you can see that all 4 of them are quite high, some higher than others. Some of them aren't even touching the curve. So she was in a state of constant chronic stress with elevated cortisol levels, which really matched how she was feeling. So it was important for her to see that she had a feedback loop going on between how she felt and how her body was perceiving it. And she was really kind of stuck in this chronic alarm state with her cortisol. We then went ahead and measured Stephanie's neurotransmitters. And yes, you can measure neurotransmitters. This is done off of a urine sample at home, simple urine sample. And we noted that Stephanie's serotonin level, circled in red at the top, as well as her dopamine in the middle circled there, were high. This is a very busy slide, but I just want you to focus on the fact that her serotonin and her dopamine were high, which means that every medication that she was getting that was increasing her serotonin and dopamine were actually backfiring on her and causing her to have more significant symptoms. So we were able to target her neurotransmitters and say, oh, okay, those are not the neurotransmitters that we want to focus on. We want to balance her by bringing those things down. We went a step further and we looked at Stephanie's genomics. So this was, again, a saliva sample done at home. And again, very busy slide, but what I want you to focus on is COMT at the very top, circled in red. Those are very important enzymes. They're chemicals in the body that help us break down and detoxify hormones in our body. Interestingly, they help us detoxify and excrete adrenaline and noradrenaline, our fight or flight hormones. And you can see next to that red arrow, those two red blocks indicating that Stephanie's genes didn't work well there at all. So no wonder she was having problems feeling anxious all the time. Every time her adrenals released cortisol, every time they released adrenaline, those hormones would circulate so long in her body that it would feel to her like she was constantly in a state of fight or flight. This was the cause of her underlying anxiety, and it was hereditary. Many of her relatives had a very similar picture. So we were able to look at her neurotransmitters, her cortisol, and her genomics and target a treatment to Stephanie that actually worked to solve the problem at root cause. So what did we do? We simply provided a form of methylation, which is a way that we detoxify our adrenaline, in the form of SAMe. This is a simple over-the-counter supplement that she was able to take twice a day that helped her break down her adrenaline and support other detox processes in her body. And when she started taking this very simple, inexpensive supplement, she was transformed into somebody who no longer had anxiety. So it was a really, really wonderful breakthrough for her, and she felt very validated that indeed she knew that there was something causing this. She just needed to figure out what it was. So as I promised, I wanted to talk about some other natural approaches to balancing neurotransmitters. I'm just going to move myself down here a little bit. This is not a complete list, but if we were going to work on somebody who had low serotonin, we can actually increase serotonin with something called 5-HTP, helps us make serotonin. We can also increase dopamine with a supplement called Dopa Mucuna. It actually works great for depression. We can increase GABA when people have low GABA and have anxiety by having them take GABA directly. And then we can also increase glutamate when it's implicated in someone's depression by taking a glutamine supplement. So as you can see, there are ways to get at balancing neurotransmitters in a natural way if medications aren't working, or if the individual decides that they don't want to use medications in their treatment. There are other options here. That's wonderful. So the other thing I wanted to draw your attention to is that there are connections. There are connections between our mental health, our brains, where we consider to be most of our mental health occurring, and other parts of our body. On the left, you'll notice that there is a connection between the gut and the brain. So having gut imbalances or gut problems definitely impacts the brain. 95% of the serotonin in the body is made by the gut, which is really, really striking. So if one's gut is inflamed, is unhappy, if someone has irritable bowel syndrome, has inflammatory bowel disease, these can directly cause problems through neurotransmitters, but also through nerve connections to the brain. So there's definitely a connection there. And as we talked through Stephanie's case, there's a connection between the adrenal glands, cortisol, et cetera, and the brain. And so when I have patients who have problems with their adrenal glands and they're experiencing problems with cortisol, they often tell me that they experience brain fog, or they'll feel depressed, or they'll feel listless. Those are direct impacts of cortisol on the brain. And so it's really important, I think, to look at gut health and adrenal health when we're looking at a full scope picture of managing mental health problems in the right individuals in a personalized way. So that is a traipse through mental health and a personalized approach. I hope this was eye-opening to you. I think mental health is one of the most important things that we can address in our culture. And so if you have any questions and want to learn more about Vital Health's approach, please feel free to visit us at www.vitalhealth.com. We are on social @YourVitalHealth. Thank you so much for your time.